The Jivi people have occupied the plains of the Vichada, the Meta, and the Orinoco rivers between Colombia and Venezuela for generations. To adapt to the diverse terrains of this relatively poor, sometimes extreme, and always demanding ecosystem has been a challenge that the Jivi have been able to overcome by developing diverse solutions for survival. These solutions are woven into the fabric of their culture. The Jivi are among the indigenous groups of the Venezuelan Amazon with the most alarming health conditions. Diseases such as diarrhea and serious respiratory infections, multiparasitic intestinal diseases, skin diseases, malaria, and tuberculosis, among others, are the main causes of sickness and mortality, especially among children. Any human group establishes a balance with the various infectious agents with which they share their environment. Some of the diseases that have always affected the Jivi relate to their lifestyle and traditional environments, to their exposure to the pathogenic agents of the plains, the forests, and rivers, and to the sanitary habits established in their culture. But it is very likely that most of the diseases they have to face nowadays come from new living conditions resulting from their contact with the outside world. The contact with Europeans during conquest and Venezuelan criollos in more recent times not only brought new infectious agents, but also disorganized their traditional settlement patterns. Larger concentrations of people settled in urban and semi-urban spaces and in new rural spaces, and the traditional forms of social control of disease were lost. In these new spaces, the new pathogenic agents caught an uprooted and vulnerable population off guard. Neither their native immunity nor the Jivi system of beliefs and customs could deal with the new threats. This is the complex situation in which the Jivi live nowadays. They number about 20,000 people, of whom nearly 12,000 live in the Venezuelan side of the border, mostly near Puerto Ayacucho and the Orinoco River, in the capital's area of influence. These people are looked after within a healthcare infrastructure that, in addition to the capital's hospital, has a set of rural health clinics. Along with the doctors, the staff of these medical care centers is made up of doctors' aides, microscopists, and health promoters, some of whom are Jivi.
Así trabajo, sequeando gente enferma, como antes no había nada de medicina, nosotros no conocemos la medicina, nada, ninguno conoce medicina, ni pastillas, ni jarabe, nosotros no conocemos nada.
In a cultural universe that explains diseases as violations of rules on how to behave or deal with the magical world, it is not easy to adapt to the prescriptions of Western medicine, which is based on a biological conception of disease.
Hay medicina que le indica el médico, ¿verdad? Le dice, por ejemplo, cada 6 horas. Y entonces le dice, esas 6 horas, ellos no saben lo que es hora. Pues claro, ahorita ya uno está conociendo que no cuenta la hora, pero ellos no cuentan la hora.
But against this lack of understanding, we must add that of our own medicine.
¿Cómo amaneciste hoy?
Bien.
Bien, ¿qué es bien para ti? ¿Qué es bien para ti? Explícame qué es bien. ¿Por qué te sientes bien?
En mi lengua.
No, en tu lengua no, o sea, en lo que tú sabes, pues que yo pueda entenderte a ti.
Yo me siento bien.
Ajá, pero ¿qué es bien para ti?
Me siento mejor.
¿Te sientes mejor?
Sí.
Ajá. ¿Cuándo te ocurrió eso? ¿En qué tiempo? ¿Qué fecha? ¿Hace cuánto tiempo?
Yo no sé decir fecha, yo no sé de eso.
No sabes.
No.
¿En diciembre, en enero, en febrero?
En diciembre después. Enero, o sea,
¿En diciembre o en enero?
enero. Me fallecí.
Casi falleces.
Sí.
¿Te sientes morir?
Sí, cristiano todas las noches.
¿Fiebre?
No,
¿No tienes fiebre?
no, hay veces me pega fiebre, sí.
A veces te pega fiebre.
Yo creo para urrirme, no sé.
Ahorita aquí hospitalizado te ha dado fiebre.
No,
¿Cómo sabes tú?
yo,
Ajá, que no hay fiebre. ¿Por qué?
porque yo no sé. Mira,
No sabes cómo.
No.
No te sientes caliente.
no,
Como ustedes pueden ver, la atención al paciente indígena es difícil. Difícil en el sentido de su misma idiosincrasia, pues son pacientes que si tú como médico le inspiras confianza, ellos te brindan toda la información necesaria. Son pacientes que si no le inspiras confianza, no colaboran para nada. Es más, tú lo interrogas y te ven, no se dejan tocar, sobre todo la mujer, la paciente indígena, la mujer, es muy pudorosa.
The lack of understanding on the part of our doctors may be explained by the lack of an adequate training to understand these cultural differences. What is evident is that sick indigenous people are immersed in a totally new situation in these hospital spaces, which are so different from their everyday environment. These cultural gaps are very difficult to bridge.
Nosotros como pueblo Jivi exigimos que nos respeten nuestro derecho a la salud, así como lo dice la Constitución Bolivariana de la República.
Para nosotros la salud no es solamente la salud física, sino también mantener la lengua, la cultura, la costumbre, la cosmovisión que nos ha permitido vivir a través del tiempo.
Throughout their history, the Jivi have faced situations of crisis, once and again, and have overcome difficult times by means of their extraordinary capacity to adapt. Among its secrets, this culture treasures a key concept, unuma, to join together in the fundamental activities of community life. Perhaps the secret to confronting the Jivi health crisis lies in the cornerstone of their history, their age-old tradition of working together as one. Only if the state, research centers, doctors, indigenous leaders, nurses, teachers, and members of the community learn from each other and develop a common strategy will it be possible to find a new approach to ensure Jivi health. Only then will it be possible to find again the way of Nakwani, the world man, who treasured the secrets to good health in the heart of the culture. And then a new day could emerge from that history of change and survival in order to weave a new future.